Abigail Fowler Miller was just 2 days old when she died following an emergency C-section. An inquest in 2023 found she would have lived longer if her mother had been admitted sooner to the Brighton Royal Sussex County Hospital. This morning we learned that 55 babies may have survived across several hospitals run by the trust responsible for that hospital in Brighton. An investigation there is underway, as well as a wider review into NHS maternity and neonatal services being conducted by Baroness Valerie Amos, chair of the Maternity and Neonatal Investigation. She spoke to us in December.
What we are seeking to do is to come up with a set of national recommendations. Some of our families have been very, very clear to me. They feel very strongly that the only thing that will make a difference is the statutory public inquiry, that it's the only thing that will give them the accountability and justice that they are seeking. We are not that, but I do hope that we will be able to come up with some systemic changes that will mean that what we are continuing to see up and down the country will stop.
Well, we can speak now to Katie Fowler, whose 2-day-old daughter Abigail Fowler Miller died. Katie and her partner Rob Miller are now coordinate a group of 15 families who all suffered poor maternity care. The group is called Truth for Our Babies, and Katie is on the line. Good morning to you, Katie. Could you just talk us through where things you felt went wrong for you and Abigail?
Good morning.
Good morning.
So I went into labour exactly on my due date. We called the Royal Sussex Hospital to let them know that, and then later in the day I experienced some bleeding, which we also told them about, and were advised that it was probably normal and we should stay at home. We called again with similar concerns a little bit later on and had the same advice given to us. The fourth time that we called, I had become critically unwell. I was bleeding internally. Abigail was deprived of oxygen, and we were told at that point we should come into the hospital, but that there was no rush for us to get there. By the time I did arrive, I was in cardiac arrest, which meant Abigail had to be delivered in the reception area of the hospital. We both had to be resuscitated and put into induced comas. And I was brought out of my coma 2 days later to meet Abigail, which was also the day that she died.
Mm. And were you aware either that beforehand that the outcomes in previous years had been poor in this particular trust?
I was aware that they had had a CQC inspection. It was actually published the month before Abigail was born that downgraded care at the Royal Sussex to inadequate. And I remember reading that and thinking, that is not good. But I was reassured, I think, by a quote in the article from the trust saying that they'd improved since they'd been inspected. So I wasn't concerned about giving birth in Brighton, and I really, really wish that I had known more and that I had been.
And what are you trying to?
Because it might have encouraged me to.
What would you have done differently?
I think if we had known more about the issues, we might just have pushed back a little bit harder. When we were told it was fine for us to stay at home, we might have insisted on going in. We had full trust in the staff. And we trusted that the advice we were being given was the right advice. And unfortunately, that wasn't the case.
Mm. And tell us a bit about the Truth for Our Babies group. How did you reach out to other people who'd been in this situation? What made you aware of each other's, I suppose, position and what had happened?
So my husband and I felt very strongly once we started to realise that there had been problems in our care. We felt that we couldn't be the only ones in that position. And so after Abigail's inquest, we did some interviews. And one of the reasons we did that was to see if there were other families out there. And a group contacted us, Truth for Our Babies contacted us. And we discovered there were, I think at that point, 7 other families that had experienced the deaths of their babies in very similar circumstances to us.
We should say that Dr. Andy Heaps, the Chief Executive of University Hospitals Sussex NHS Foundation, says, I want to say directly that we did not always get this right. As Chief Executive, I take responsibility for that. I'm deeply sorry for the pain and distress that you Katie, experienced. The trust, he said, is now fully recruited, having hired 40 more midwives. Wes Streeting has also said there will be a specific investigation into that trust. What more would you like to see?
What we want is for the trust to improve as much as it needs to ensure that everyone gets safe care there. We don't necessarily believe that they are at that point yet, based on the fact we've heard from families that lost their children as recently as last year. The other thing we want is accountability. We want the trust held to account for the failings that caused 55 babies to die.
What does that mean, held to account? Does that mean fined? Does that mean prosecuted? What does that mean?
It means for me, scrutinised and kind of, I want the systems looked at, I want the processes looked at, I want to understand what went wrong there that caused the care to become so unsafe. And I want that to be done publicly so that it can't happen again.
Well, Wes Streeting has declared an investigation there. In fact, a spokesperson for the Department of Health and Social Care told us it was actively working with families in Sussex to appoint a chair and agree terms of reference for this vital review. Do you have confidence that this investigation will give you the things that you've just outlined you need?
I have confidence that it would if it is led by Donna Ockenden. That is who we would like to lead the review. At the moment, she hasn't been appointed, and that's what we're working on at the moment, is trying to come to the point where she is leading the review.
Just why her?
Because we trust her. We know that she's done good work in other trusts. And
Okay. Okay, well, we'll see. I just have to also say, for the Trust was also told us in a right of reply, the Trust pointed to the latest data saying mortality rates reduced to 2 out of 1,000 births in October 2025, down from 3 in 1,000 in April 2024. They say throughout the last 3 years, the rate has been markedly below the national rate and is now less than half the level of the latest 2023 national benchmark. But our thanks there to Katie Fowler and her group, Trust for Our Babies.